If you're on Medicare, you've probably heard about the Inflation Reduction Act and how it's going to affect Medicare beneficiaries going into 2025. So what I'm going to do is I'm going to basically break down the Inflation Reduction Act, how it works, and also I'm going to bring up a topic that I bet you probably haven't heard anywhere else called smoothing. My name is Bill Green. I'm a Green Insurance Agency. We have helped the seniors in Northeast Florida and across the country help understand their Medicare since 2014. In that time, we have 350 plus 5-star Google reviews. We are here to help the community understand their Medicare and be their resource when it comes time to either enroll for the first time or enroll going into next year. Let's get into first how the Medicare drug plans work, just in general. So it's been this way for a long time. You have what's called the initial deductible phase. Some plans have this, not all. It depends on your plan. So in a deductible phase, if your plan has one, you'll pay the full cost of medication until you meet that number. Some plans have no deductible at all, some plans have a partial, some have a full amount. Once you've met the deductible, or if your plan doesn't have one, you go straight into what's called the initial coverage phase. In the initial coverage phase, you and the plan combined have to spend about $6,000 in 2025. So the way that actually works is if the plan pays $1, if you pay $1 at the pharmacy, but the plan pays $99, that $100 is what counts towards your initial coverage phase. Once you got in the initial coverage phase, you can fall into what's called the gap, or what maybe we'll call the donut hole. In the donut hole, you pay 25% of the cost of medication, and again, you and the plan combined spend about $8,000 from that initial, so an extra $2,000 to get all the way through the donut hole. So here in 2024, if you got through the donut hole, you fall into what's called the catastrophic phase. Now, in years past the catastrophic phase, you would pay 5% of the cost of medication. Now, if this is generic, that's no big deal at all. But if you're on some very expensive medicines, usually cancer medicines or some other heavy stuff, that could still be hundreds or thousands of dollars a month, paying 5% of the cost. Now, in 2025, in the catastrophic phase, you have a zero copay if you make it all the way to the catastrophic phase. So where that becomes a big deal is finally in 2025, the Inflation Reduction Act, we're going to have a first time ever a $2,000 max out of pocket on medications. Now, while that sounds amazing, here's the thing. Only 4% of Medicare beneficiaries across the country actually will get to that number before next year. So that means that 4% of the population is really going to benefit from this. Well, what about the other 96%? That's yet to be seen, as we can't see the Medicare plans for next year yet until really October 1st. So we don't truly know what's going to happen yet. We have some ideas I'll touch on in just a few minutes. But only 4% of the population is really truly going to benefit from these, the catastrophic and the max out of pocket of $2,000. So along with that max out of pocket of $2,000, we have something new called the maximum monthly payments, or M3P. Not MP3 like you may have downloaded years ago, but M3P, maximum monthly payments. Or it's also being called smoothing. So smoothing, what it essentially does is, and the M3P, is it's going to smooth your costs out over the year. So say you go to get your medicine for the first time and it's $500-$600. You can't afford that, or maybe you can, but it would really hurt you. So what smoothing is going to do is it's going to smooth the cost out over the year. You'll have to ask your plan to participate in this, and not everyone really needs to. It's only those folks who do have expensive medications. Basically what they'll do is if you're scheduled to hit that max out of pocket for the year, is they'll break that $2,000 down by 12 months, and you'll get your medicines at the pharmacy just like you normally would. You won't pay anything at the pharmacy, but you'll get a bill from your plan that you have to pay every single month. Now here's the thing. If you don't pay the bill, well, the plan technically can't drop you, but they are not going to continue to fill your medication for you, and because you'll be dropped off the program, and you'll have to go back to paying everything you owe, plus what you would pay at the pharmacy. So smoothing, again, is for those folks who are going to hit the $2,000 max out of pocket. It's not for everyone, but it's definitely available for those who truly need it. So another part of the Inflation Reduction Act is a cap of insulin at $35. Now this actually started back in 2021. The Instant Senior Savings Program was initiated. Back then, plans could choose if they want to participate or not. They would have to have a max of pocket of $35 on insulins if they chose to. Well, the choice is now gone. Any plan that is participating in a Medicare Part D drug plan or Medicare Advantage plan that includes a Part D now has to offer insulins with a max $35 cap. Now here's the thing, there are some plans that charge $35, there's some plans that charge less, and there's some plans that charge zero. It just varies from plan to plan. And it's for true insulins. things like Humulin, Novolin, Novolog, stuff like that. It's not for the newer stuff like Ozempic. So if you're on the Ozempic because it controls your blood sugar really well, that's awesome, but it doesn't fall into the $35 category. So starting in 2026, Medicare will finally, long overdue, be able to negotiate drug costs with the manufacturers. So we don't truly know what that's going to look like at this point because it's happening in 2026, but we certainly hope and expect medicine costs to come down at that point. So again, 2026, we'll see what happens at that point, but in 2026, Medicare will finally be able to negotiate the cost of medications directly to the manufacturers. Lastly, a big point here is Medicare Part D vaccinations. So Medicare Part D vaccinations, for years, you'd go to the pharmacy and you'd either pay a small copay, or things like shingles, if you had a deductible, you'd end up paying the full cost for it. Normally a full shingle shot, the 2 rounds would be between $300 and $450, depending on your plan and what the costs are within it. Starting a couple years ago, 2023, Part D vaccines are now zero copay. So you can go get that shingle shot that you put off forever. It's now going to cost you a big fat zero nothing at the pharmacy. And that includes a few other things like tetanus and some other shots. So nice thing, the last one is that Part D vaccines are now a zero copay through a Medicare plan that includes a Part D or a Medicare Advantage plan that includes prescription drug coverage. Another big thing that's coming into play in 2024 and 2025 is Medicare Extra Help or low income subsidy. You may even see ads from Medicare.gov on your social media feeds talking about a new law that helps lower the cost of your medications. It's not really new, it's been around for a while, so it's kind of Medicare using the same unfortunate marketing tactics that some insurance agents use to sort of deceive. But for Medicare, it's more of a good thing. The way Medicare Extra Help or low income subsidy works is in prior years, you would have to have a income level 135% or lower than the federal poverty limit. And what that does is it makes your deductible for your medicines go away. It gives you a very low cost for medications. Good news, in 2024, the federal poverty limit level for low income subsidy or extra help is now 150% of the federal poverty level. That means you make a little more income and get extra help with the medications. It's very unfortunate. I've had a lot of folks over the years be over by $5, $20, $50 a month and have to pay full cost for these medications that would almost wipe them out. So thankfully, 2024, it's now a cap or a threshold of 150% of the federal poverty level to get extra help with the medications. So you've heard me mention Medicare Advantage plans several times through this video. Medicare Advantage plans are definitely affected by the Inflation Reduction Act because the vast majority of them include a Part D prescription drug plan benefit. Now, we don't know what those plans are going to look like at this point because we can't see those until October 1st of 2024, the year I'm filming this video. But we're expecting, with the higher cost of medications, we're expecting probably medicine copays to go up, maybe some added extra benefits to be scaled back a little bit, a little less dental, a little less vision, stuff like that, and maybe some copay adjustments. We really won't know until we see what happens actually October 1st when the plans are truly released, but that's kind of what we're expecting to happen with Medicare Advantage plans. So we talked about several points throughout this video. The catastrophic phase, the $2,000 max out of pocket, M3P or smoothing for your prescription drug plan costs, the cap on insulin cost of $35, drug price negotiations, free vaccines, the expansion of Medicare Extra Help or low income subsidy, and how all of that stuff is going to affect Medicare Advantage plans. So I hope you found this video useful. If you have, please do me a favor, like and subscribe. Leave a comment down below. Let me know what you found to be the most helpful out of this video. Stick around for the next one.